Hello YouTube, it's your girl Danny. I am coming back to YouTube to talk about where I have been for the past several years. So I'm going to try to pick up where I left off about my post-op for my ACDF anterior discectomy fusion surgery that I had on my neck on 3 discs in my neck. And everybody's been asking where have I been. So, I don't know if I ever shared this like in one of my videos previously, but in 2007, I was diagnosed with trigeminal neuralgia. I suffered in silence for 10 years. I didn't tell only the people that were close to me that knew about what I was dealing with. I was at work one day. I'm gonna try to do this like maybe in a 3 or 4 part. So just kind of bear with me. I'm trying to remember everything. So, basically, I was at work, sitting at my desk, and I was eating some candy. And the candy that I was eating were called Skittles. So basically, I popped a few into my mouth, and just continue to do my work like as usual. So when I bit down into this piece of candy, there was a sharp pain that had like went from my head all the way down to the side of my face on my right side. Well, y'all looking at it, it should be left, but it's my right side. And it was almost like having a toothache, which considerably most people would actually think. And with trigeminal neuralgia, it is the fifth cranial nerve that comes out of the brain that supplies sensation to the face. So that nerve basically is the nerve that sends sensation, like if you're eating ice cream or drink something really, really cold and it gives you that headache. But this was not like your typical headache. This was like I was being electrocuted, okay? So I stopped eating the candy, and I was like, well, I'm not even going to eat anymore, and, whatever. So I was like, well, maybe I do have a cavity. Maybe I need to go to the dentist or whatever. So I didn't have another pain for probably maybe about 30 so minutes or whatever. So I got bored, okay? So when you're doing desk work, you can get bored real quickly. So I decided to pop a few more in my mouth. I said, okay. Pain came back. I said, we're not going to do this one. So I threw the whole bag of candy in the trash can. I called my dentist. I told him, I said, I need to come in. No, a day went by. A day or two went by. The pain kept coming. I wasn't eating anything at this point. Woke me up out of my sleep. Okay, so I said, it's got to be a tooth. I called the dentist. Told him what was going on. Explained it to him. He said, well, you can come in this afternoon, blah, 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 blah. I said, okay, then. I went in. His first thing was he did an x-ray and everything. He said, well, it's probably the mercury cavity. I mean, the mercury filling that you have in your tooth in the back. We no longer do mercury anymore, so we're doing like the white porcelain or whatever it is today. So he said, and it does need to come out. I said, okay. So I assumed that it was a tooth, okay? So I had the tooth pulled. And a couple of days later, the pain came back the same way. So I called him. I said, look, did you leave anything in? Did the tooth break off in there? Or were there any kind of bone fragments or something that was left in? Why am I still hurting in my mouth like that? He said, give it some time because it was an open nerve. And so, it takes a minute for it to calm down or quiet down or whatever. Okay. A few more days went by. Still having the same pain. By this time, the pain had intensified. I was drinking something. And literally, it made me put the cup down, hold on to the side of the refrigerator, and just wait till the pain subside. Because I've never in my life ever felt anything like this. I've had kids. I've had broken bones. I had pulled muscles and strains. But this was like one of the worst pains that I have ever had in my life. Even recuperating from surgery, nothing could compare to what this thing was going on. So basically, the pain can be triggered by a slight breeze from the wind, washing my face, brushing my teeth, talking. It didn't matter what was going on. Any kind of way I was moving my face, I was having a pain. So one night, I was laying down in the bed, and I was watching TV, and I was getting ready to go to sleep. And I think I had drifted off to sleep. And by the time I got comfortable and drifted off to sleep, that pain started coming. It felt like somebody was literally throwing electrical currents in my face. They were just like back to back. It was like after one hit, here come another. They were almost coming like every 2 to 3 seconds. And then they would last from 1 second to 5 seconds to a minute. It was just like constantly. So my husband took me to the emergency room. When I went into the emergency room, I got a doctor. It didn't take long for me to be diagnosed. It did not. I explained to him what was going on, told him what I had done, and this was probably about like a week or so into it. And he said, I know exactly what you have. And he said, what I'm going to do, I'm going to prescribe you some carbamazepine, which is the generic name for Tegretol. Tegretol and carbamazepine is a anti-seizure medication that they use to treat trigeminal neuralgia. So it's a medication that they normally prescribe for patients that have seizures. Okay. So and he said, what I need for you to do after I give you this prescription, he said, I need you to follow up with your PCP. And so that way they can monitor your levels and stuff with the medication, make sure that you're getting the right amount or whatever. I was like, okay. And he gave me a pamphlet and told me to read up on it. And I did. I read up on it and everything. And I stayed on that medication for probably about 6 months before I had to get an increase. So I did go to my primary care doctor, and she continued to see me. I took that medicine like religiously, like clockwork, like one pill a day. And I can't even remember the milligrams or whatever right to this day, because it's been like 4 years almost since I've come off of the medicine. But every year from 2007 all the way up until I actually had surgery. So that's where I've been. And I had to have a microvalve decompression on my trigeminal nerve. And that is where they go into the back of your head. Like I had mine on my right side because it was my right side that was affected. And normally it only affects one side of the face. And I still today have every now and then would get little twinges, but not much, nothing nearly to what I was having. But over the years from 2007 all the way up until 13, they started to get progressively worse. I think in 2014 was when I really, really started having a lot of problems. After I had my neck surgery, they started coming quite often. They would come and they would last 2 minutes long for one episode. Days I would be in the bed, I could not talk. This is how my life was. I would talk through my teeth, can you bring me something to drink? Try not to make any type of sudden gestures or anything like that. I rarely wore makeup. And then with the medication that I was taking, it caused me to have breakouts in my face. I was really going through some stuff. And I continue on this relentless cycle with the trigeminal neuralgia, still having problems out of my neck, still having these bad headaches. I mean, it was just one thing after another, nothing helped. I mean, I was literally felt like I was I can't even say deteriorating, and there was nothing that I could do about it. Nobody was listening. By this time I had gone through 3-4 doctors. The doctor that I had ended up retiring, and then we moved out of the city, so we moved to the country, the county. So then I had to find another doctor, and then after I had that doctor, then that doctor stopped practicing, and then insurance changed. So the doctor that I was seeing was no longer in my network. So now I had to find another doctor and start all the way back over with all of this crazy stuff. So, bring you up to speed. So, in 2015, I went on a 6-month episode. I had a 2-month break from January to June. No, January to April. I was in a flare-up every day. Wake up with it, go to bed with it. Wake up with it, go to bed with it. And then by the summertime came, I was a little better. I would have a twinger here, there, and it says that it does go into remission. And I would, even the years prior to the long chronic episodes, I was like, oh my gosh, I'm in remission. I don't have to worry about this. I can eat this. I can do that. I can chew gum. I can do all of this, and I was cool. Everything was fine. And then I would have like a month episode, then it'll go away. Then I have another month episode, then it'll go away. This was my life for going on 10 years. It was like relentless. Still dealing with my neck issue, okay? Which I will bring you up to speed on that. So, and right here, I'm going to put my picture up here. This is when I had my surgery in 2016. I was in the hospital for 3 days, okay? So it'll be right there. So, yeah, I had to have my head shaved on one side. So, yeah. But anyway, that was the most scariest ordeal I have ever experienced in my life. Like I said, I've had plenty of surgeries in my lifetime that'll last me from Timbuktu. So it was rough. So basically, when I had started, well, I was in school, and it was just like I just couldn't do it. It was just like, why bother? I didn't want to be around anybody. I didn't want to always have to explain why I didn't want to come, why I was making excuses, because I never knew when I would get these electrical shocks in my face. And, people would say, well, you just, you don't need to isolate yourself. I say, yeah, but when I can't talk and I can't explain to you what's going on, and then you're looking at me all weird, and I did get some strange stares, like, I literally, my whole appearance, I think I can find a picture of when I was actually having an episode. Let me see if I can I'm going to probably put it right here, where I was having the episode with my neck hurting and a real bad migraine all in one. Like, I just could not, get no relief no matter what I did. Medication. And I felt like a walking medicine cabinet. By the time I got ready to have my surgery, and this is everything that I was taking, if I can remember. I was taking Flexeril. I was taking Tegretol. I was taking gabapentin. I was taking ibuprofen 800. And then the gabapentin that I was taking, I remember that was like 600 milligrams per pill, and I was taking it 3 times a day. 3 times a day, okay? And then my Tegretol, I was now taking 3 times a day, okay? And the muscle relaxers, I was taking 5 milligrams, I think, or 10 milligrams, like every 6 hours or something like that. And let me tell y'all that even though I was taking all that medicine, I was still wide awake. A lot of times. Yes, I was. That wasn't doing nothing. And they did prescribe me I did have a narcotic. I think it was Percocet. That was the other pill that I had. All of this medication that I was taking, and I had it where it was being timed how I was to take it. I only took the Percocets when I got ready to go to bed, just to be able to try to get some sleep. But when you're in a full-blown cycle, it nothing. I had like ice packs, heating pads, wet face towels, everything. Oh, the other thing that I did, I used the Ambisol, like what you would use for a toothache, and like Oragel and stuff like that. I was literally taking cotton balls and trying to saturate that stuff and sticking that stuff like all around in my gums and everything. Anything that would numb that pain. All in the back of my jaw. It was really, really bad. And then it was like I was getting the burning sensation, burning, heat, and the shocks, and the headaches. Everything, all of this all coming at one time. So still dealing with the neck issue. We're gonna get to that. Alright. So that year, that was 2015. By that Christmas of 2015, I had pretty much had enough. I was like, there's no way I can keep doing this. No way. I don't want to keep doing this. This is just way too much for me. And so I was like, okay, we got to think about something. So I did finally find a doctor at the Sims Murphy Clinic here in Memphis, Tennessee. I Went through all, because it's a, like they deal with spine and brains and all this kind of stuff like that. So it was the same clinic that I went to where I had my neck surgery. So I said, okay, hey, I'm going to give it another shot. I said, because this is not for me. 2016 came in. By May of 2016, I was like, this is it. Either they're going to have to do something or I'm going to lose my mind. I said, because I cannot continue to do this another 6 or 7 months. So I found a doctor by the name of Dr. Swanson. I went in. I told him what was going on. I said, I've been having this pain for the last 10 years and I can't take it no more. And prior to that, the neurosurgeon that I saw before that, Dr. Stein, he was telling me like in 2010, like, go ahead and have a surgery. I'm like, y'all ain't cutting my head. No, I'm not ready to do that right now, because I did not know enough. I started watching YouTube, looking at the procedure, getting familiar with the disease and stuff like that, what causes it, and why do so many people only have it, and why people don't acknowledge it as a disability, or what's going on with this. So basically, according to I got some notes here, so y'all just bear with me. And this is what they said. Now, I'm just going to read it straight from the website. It says, trigeminal neuralgia, also called tic douloureux. And it said it's a chronic pain condition affecting the trigeminal nerve in the face. The trigeminal nerve carries sensation from the face to the brain. So I had it backwards. So it's from the face to the brain. It's most common in women over 50. I'm nowhere near 50. I went out when this thing came running and knocking at my door. Fewer than 200,000 U.S. cases per year. And now get this now. It said treatment can help, but the condition is there is no cure for it. When you start thinking about having brain surgery as another alternative to alleviate pain or to help with some of the symptoms, you almost try anything. And it said lab tests and images are rarely required because there's no blood test that they can do on you to determine if you have it or not. The only way that they're able to find it is doing an MRI. And these are some of the symptoms. And this, I think I can't say I think, but I did say this in the beginning. Symptoms can range from mild to severe facial pain, often triggered by chewing, speaking, or brushing the teeth. No matter what I did, it hurt. And it said the pain areas is in the mouth and in the face. And oversensitive or uncomfortable tingling and burning is like muscle spasm. Look, I'm just going to tell you like this. It hurt. It hurt so bad. I would rather have a broken arm than that. Because I know once the arm gets set, it'll be fine. And I don't have to keep worried about it constantly coming. And then it says like treatment consists of anticonvulsant and nerve pain medication. Treatment includes medication, injections, and surgery. And like I said, the medication where they say anticonvulsant, that's exactly what it is. They give you prevents or controls seizures, relieves pain, and treats symptoms of certain psychiatric disorders. Okay. And it's terrible. And it said eases suffering and improves quality of life for those in pain. And it treats nervous system disorders. And it said prevents, diagnoses, and treats diseases. So those are the specialists like pain management and neurologists. You have to have one of those and your primary care provider. All of these people work together for your care to help you with the illness. Because definitely people that don't know, and one of the things that it's causing me to really kind of speak out about it now, because a lot of people that do have it do live in silence, and they live in silence because the fear of being judged or ridiculed or saying it doesn't take all of that. Y'all do not even know the half of it. I promise you, you don't know the half of it. It's terrible. And not only do you suffer with it, but the people that's closest to you that really, really understand. I'm like, I thank God for my husband. It was difficult in the beginning to, trying to get him to understand until it was like at the point where I actually really had to have surgery. You get what I'm saying? Not saying that he didn't believe me, but it was just a lot. It's just a lot because prior to that, I had had a bad leg injury. I had a neck injury. You know what I'm saying? It was like, and none of these things, nothing that I was doing to cause it. Except, well, the knee injury, yeah, I was dancing. So, but what I was doing shouldn't have done that. You know what I'm saying? It just, the joint just popped and it snapped loud. So, but as for my neck, I didn't do nothing. I did not do a thing. You know, it just one of those days I was trying to pick my grandbaby up and couldn't pick him up, and I was like, felt like I was paralyzed from the chest down. Like I could not literally move my neck, and sometimes this still happens. So back to the getting ready to have the surgery. So when I talked to Dr. Swanson, he said, well, what we're going to do is get an MRI. And I was telling him, I said, Dr. Swanson, I'm still having problems with my neck. I said, I had my surgery. I don't regret having the surgery the first time. Let me clarify that. It did provide me some relief, but not enough. It didn't stop. It's still bothering me. So I told him, I said, I have this headache. And this headache that I had, y'all, it literally felt like somebody had my head in a vice grip. Like literally like taking a vice grip, putting it on the back of my head, and every time I blinked, it's like it was getting tighter and tighter and tighter and tighter, no matter what I did. And just say like something that I do now, if I have to sit down and put my shoes on, you know how you can just kind of like bend over, tie your shoes, or put your shoes on like that. I can't do that because I may fall. But I literally would try to lay across the bed. Just imagine you laying yourself across the bed, like you're gonna just get on your bed and you're just gonna lay sideways, lay across the bed, not in the bed like you're going to sleep, but just lay across and maybe watch TV or something. Whenever I do that, literally it just feels like I have so much pressure in my head, and it makes my eyes close up. It's like I'm like, oh my gosh, what is this? Like seriously, I know what it is now. Or when I try to sit up, or if I sit up too long, like this is what I do. I can sit up for maybe about 2 or 3 hours before I need to lay down, if that makes sense. Because if I'm sitting up too long, it feels like my head is literally going to explode. My head is literally, really, this is how I feel, really too heavy for my neck. And it feels like, I feel like a bobblehead, like seriously, like you know, like that, like it's like it's just very complicated try to even to explain it. And I kept telling him, I said, I'm having like these dizzy spells, I have ringing in my ears, I have numbness and tingling still in my arms and in my shoulder. Now I'm having problems out of my right shoulder, still having the neck issues. So I went to see well, let me back up. So anyway, 2016, I was telling him all of these things. I'm having all these problems. He said, okay, this is what we're going to do. We are going to literally have to do this MRI. And whatever the MRI says, this we'll go with your form of treatment. Okay. They get my MRI done. They made me an appointment for like 2 weeks out. Okay. But when they got my MRI back, they called me earlier. They said, we need to see you in the office like within the next 2 days. So we're going to work you in. I was like, oh my gosh, that's never good. You know what I'm saying? Like, that's never good. So we go in and we sit down and we talk. He said, well, we got 2 things that we're looking at. He said, one, he said, out of all the cases that I've ever had with somebody that has trigeminal neuralgia, he said, I've never seen a case like yours. And I'm looking at him. I'm like, I don't even know what to do. Like, do I need to just run, or do I want to hear what he has to say? So I look over at my husband. I was like, he said, we looked at your trigeminal nerve, and your trigeminal nerve has looped around the other vessel or artery or whatever in the brain. I don't even think I had a response. You know, like, what? He was like, we can do the surgery, but there's no guarantee that we'll be able to successfully pad the nerve in your brain. He said, but we can do something to give you some relief. I said, okay. I said, Dr. Sorensen, now what about my headaches? And the numbness and tingling in my neck and all this other stuff. He said, that's the other thing I wanted to talk to you about. We did find a Chiari malformation. I'm like, what? He said, it's been present in your head since birth. And he went to explain to me what that was. And I'm sitting there looking at him like, you are speaking a foreign language. I have no clue of what you're saying. He said, well, I'm going to give you this pamphlet. I want you to go and read on it. He said that, because if you go back and look at my other video that I did where I talked about, still having neck pain and my head hurting and all that, that was in 2015. This is 2020, still 5 years later, and I'm still complaining about the same exact thing. Okay? He says that was present ever since birth. He said what happens is, I'm going to see if I can, let me see. Okay, I'll use this hand. I'm going to put that up there. This is what Chiari malformation is. You have one side of the brain that is normal, where your brain is sitting right in the skull, and then the picture right next to it, it has it where the brain, the cerebellum tonsils are protruding down into the spinal canal, which gives the pressure headaches, the neck pain. All of this stuff is trying to compete for space in your spine. Okay, that's a lot to swallow in one sitting, okay? Already facing one surgery. So my thing was, well, can you do both? Can you do both of them at the same time? He said, no, they're too big to do together. Okay, so now remember, I'm sitting here, I'm like, I ain't having another surgery. I just don't want to. You know what I'm saying? It's just, and it's not the point of not having the surgery. It's preparing mentally to have a surgery, and then dealing with the pain and stuff prior to. Then you have to deal with the surgery within itself. Then you got to deal with the recovery process. You know what I'm saying? It's a lot. It is a lot. So I go, all right. I go ahead and I prep for surgery. He said, and by I think this time was probably like sometime like in November or something. And he said, well, we can get you in as early as December the 16th. Day we can do your surgery. I said, okay. Okay. I go ahead, schedule for my surgery and everything. I was terrified, y'all. I'm not even going to lie. When I say like having a surgery on your stomach, or having a surgery, having your tonsils taken out, having my neck surgery, my knee surgery, I was like, okay, hey. But now they're talking about going in my head. Y'all, all I can tell you was that was one of the most serious surgeries ever that I've ever had. And I'm speaking out about it because October the 7th is, let me go on this side, National Trigeminal Neuralgia Awareness Day. So when you see people wearing blue hair and teal and things like that and have the ribbon, and I'm put the ribbon right there, so just know when you see that, it's National Trigeminal Neuralgia Awareness Day. Okay, now we're going to talk about Chiari. Chiari is the whole entire month of September, so you will see me sometimes wearing purple for that day. So it is for, I wouldn't say every day, but I try to, in the month of September, like put on some purple lipstick, a purple shirt, purple eyeshadow, purple wig. Hey, you just never know. I try to bring awareness to those conditions because they do not get the attention like your breast cancer, your colon, any type of cancer that there is. You have awareness for heart disease. There's a big awareness for diabetes, juvenile diabetes. You have something for arthritis. You have something for MS. I think their color is orange or something, but not for these other illnesses. And people are literally like not coming out of it. Trigeminal neuralgia is known and has been called, or is called, the suicide disease. I'm a part of a few support groups, and a couple of ladies and gentlemen have committed suicide because when they say it is one of the worst pains known to man on this side of earth, it is horrible. And this is the thing that I try to tell people. I said, even though I was struggling with all of these debilitating illnesses, I still managed to go to school. I still managed to run a household as much as I could when my body would allow me to. And I'm not even done yet. When my body would allow me to. And so I was like, you know what? Something has got to give, because I'm literally like, feel like I'm like really dying here. That's just the way I felt. I hurt all the time. And so I dealt with that. Had my surgery. Still wasn't good. Like, I spent 1 day in ICU. I spent 2 days on a regular floor, and I went home on the third day. I It was a slow road. When I tell you guys, it was a road and a half to get back to me. You know what I mean? Like, literally, like, I could not drive for a while. I would get hurt, you know, just like nothing. It was crazy. It was literally crazy. It was literally crazy. I mean, it was horrible. So I'll kind of bring you up to speed now. Y'all bear with me. I'm trying to fix something. Okay. All right. Sorry about that. Okay. Got to fix something with my phone. But anyway, I said, okay. I come through it with flying colors. I go home. I try to recuperate. Y'all, when I tell y'all like stuff like now with me, being diagnosed, confirming that I had trigeminal neuralgia. Well, I already knew I had it, but with just confirming how bad it was. They told me when they went in, they did pad, but they couldn't pad as much because of something about a perforated brain or something was going on in there. I have all my reports and stuff, and they could only go so far without causing me to have a stroke. That was what was told to me. Okay, so now we are still dealing with this neck. Okay, so I still been trying to get, a resolve on that. I have gone to the doctor since then. I'm back in a neck collar. Like, now I really need to put it on, but I'm not going to for the video. This is my neck collar. I put an old sock that I had lost the other mate to, so I just used that to kind of help, but I am back in a neck collar. And I do need to put it on, but I'm not going to put it on. I'm going to wait till I finish this video. Let's see. So now I am to the place where I done had the surgery, and I'm still not getting better. When I say I'm not getting better, I ain't getting better. I go, because now I'm having other issues.